3-year-old Greenwood boy is on a new medication that has dramatically extended his life expectancy. This week, he and his family are in Washington, D.C. advocating for pediatric health care. 5 News reporter Claire Everbach is here now with their story. Claire?
Yes, Darren, 3-year-old Dean Cox was diagnosed with cystic fibrosis just days after he was born, a disease that affects the lungs, pancreas, and GI tract. Dean had his first surgery at just 5 days old and was hospitalized 8 times before his first birthday. But a new medication has turned his life around, and now his family wants to make sure all kids have access to the medical care they need, regardless of their finances.
We're up top. We're up high.
Lauren Cox recalls learning of her son Dean's diagnosis with cystic fibrosis.
I remember having the thought, like, I can either be sad about this and depressed about this and spend my whole life worrying about it, knowing it's not going to change, or I can try and advocate for it.
And she chose to fight. Doctors at Arkansas Children's put Dean on a drug called Trikafta, which is extending his life expectancy from 25 to nearly 80 years.
This new medication is allowing him to live such a normal life.
Out of pocket, the drug costs $30,000 a month, but private insurance and Medicaid make it affordable for the Cox family.
Without Medicaid, we can't afford that.
Since starting Trikafta, Dean hasn't been hospitalized once. His experience with the medication inspired his parents to advocate for other families. They're in Washington, D.C. this week for the Children's Hospital Association's Family Advocacy Day to share Dean's story with lawmakers and advocate for other kids like him.
But it's just eye-opening how many children there are out there that this affects, and especially some that you might not even know are sick.
Dean's father, Walker, says Medicaid is a huge help in easing financial worry.
I wasn't thinking, like, great, my kid's alive. I was thinking, how am I going to pay for this? Like, that's all I could think about, and I felt terrible for thinking about it. But Medicaid lets us live a normal life.
Before taking Trikafta, Lauren and Walker were consumed with the thought of,
I don't want to outlive my child because of a medical reason.
Thanks to access to this medication, Dean is full of life and doing what he loves most, camping and playing with trucks.
Chronic illness.
As you can see, the Cox family met with Senators John Boozman and Tom Cotton in D.C. to talk about the vital role of Medicaid in their lives. The Children's Hospital Association advocates are also talking with policymakers about ways to address the doctor shortage, mental health issues facing kids and teens, and more. Claire Everbach, 5 News.